Hello, my name is Chris. I'm a retired Canadian pharmacist. Welcome to this 7-part series titled What Every Pharmacist in Canada Needs to Know About the Design and Teaching of Doctor of Pharmacy degree programs. This is Part 5, Individual and Group Application Exercises. It's my intent in this Part 5 to speak more about the integrated use of teaching methods, and specifically here in Part 5, the integrated use of experiential education with individual and group application exercises. Scientists are responsible for their own learning throughout their careers. They must be able to identify and act on learning opportunities. It's common sense that most of those opportunities will stem from their practice-based experiences. Similarly, students must learn to identify and act on learning experiences such that at graduation they have all of their skills well honed for career-long continuous professional development. Now, small group discussion as an example of a group application exercise does integrate well with experiential education. Students are excited to talk about their work. They will do that in their practice sites, but time in practice sites, time to talk in depth about their experiences with their on-site preceptors is very limited. So the students must bring their experiences back into the pharmacy school, physically or at least electronically. So you can picture a small group facilitator meeting with a group of 6 or 8 students. He or she can ask an individual student to describe an experience, and the student will have no problem doing that. They'll be excited to do so. But when asked to identify a learning opportunity based on the experience, then the student is likely to struggle. They'll not be familiar with that form of teaching and learning. So the long-term goal for the facilitator is to transition the student from the dependent student, needing somebody to identify learning opportunities for them, to somebody who is well skilled at identifying and acting on learning opportunities. So to begin with, just to start the transition, the experienced preceptor will be able to identify a learning opportunity that the student overlooked and can set that for the student as a self-learning exercise to be reported back at the next meeting of the group. This business of looking back on a past experience, teasing it apart, looking for ways in which it might have been improved such that you can take that learning into your future practice is not innate. It's a learned skill. So that's why every bit of the 4 years of the Pharmd program should emphasize that ability, learning to identify and act on learning opportunities. Now, the major advantage, or one of the major advantages of small group discussion, is that all students in the group benefit from each student's experiences. If a discussion is taking place about an improvement strategy based on one student's experience, then all students will hear that improvement strategy and have the opportunity to take it back into their own practice sites. One student's experience benefits all. Small group discussion, the benefits also extend to students learning how to offer and receive constructive criticism. Students at the start of the program are likely to be defensive. They will be afraid of their self-confidence and their self-esteem being bruised, that they'll be embarrassed and shown up by being asked questions. So again, this concept of transitioning students, what you want at the end of the day, even if the day is 4 years long, is to have a student who has moved from a defensive posture to someone who is keen to express their work in an audience, to an audience, and receive feedback from the audience such that the student may find ideas that he or she can incorporate into his or her own work. Another advantage of small group discussion is that the facilitator can gauge each student's understanding of the basic clinical and humanistic sciences, and perhaps more importantly, the ability of students to apply those sciences in the practice setting. So if a student describes a patient with a headache, the student can be asked as to what forms of headache there are and how you would distinguish between one form and another. In terms of treatment, the student could be asked to explain why one form of treatment was preferred over other potential forms of treatment for the headache. It's common sense, knowing ahead of time that they will be questioned, that students will go to inordinate lengths to prepare, to anticipate questions and have their answers ready, such that they are not going to be shown up, not going to be embarrassed. That form of preparing for a presentation is an excellent teaching method in the context of driving knowledge into long-term memory. It's a very effective form of teaching. I haven't mentioned anything to this point in time much about the individual application exercises. They do share many of the benefits of small group work, but you can picture the same context of a student paired with a preceptor, but this time on a one-on-one basis, and the interaction would be written as opposed to spoken. So a student can write about an experience, the preceptor can provide feedback on that experience and perhaps make suggestions for how the student could improve their work. And that dialogue could go backwards and forwards many times. It's the context of improving the work rather than grading the work. You can then picture that at the end of a 4-year period, the Pharmd program, the student would have a fairly lengthy portfolio of written examples of their work that could be used in assessment procedures, perhaps going before an examining board to see whether or not the student had met the criteria necessary for graduation. Becomes an important theme there. Now, I have in all previous episodes spoken about quotes from the literature, and I will continue that theme here. Again, as before, I'll read it out so that I don't misspeak. Pharmd curricula that foster teach to the test or regression to the norm behaviors. That's a critique of an entry to practice Pharmd program. It's interesting because the same critique was levied against the old baccalaureate programs. To my mind, that's further evidence that when the transition to the entry-level Pharmd program was made, that it was the old baccalaureate teaching methods that were brought over in preference to the incorporation or starting and paying attention to evidence-based teaching methods recommended for Pharmd programs. A few seconds to talk about the upcoming Part 6. That will be the integrated use of experiential education with technology-mediated learning. To finish today's class, I'll ask the same question that I've asked at the end of all previous parts of this series. Ask you to cast your minds back to when you were pharmacy students. Would you have benefited had you had the opportunity on a frequent and regular basis throughout your entire program to spend time in practice settings with your sleeves rolled up? If the answer to that is yes, then I'll encourage you to view all parts of this series. I'll encourage you to talk to your colleagues, talk to your local, territorial, provincial, national pharmacy organizations, talk to your local pharmacy school, talk to the accrediting body, talk to anybody who will listen, but drive a process leading towards the move to improve accreditation standards, the move to incorporate evidence-based teaching methods in the education of pharmacy students. Thanks for watching. Your comments, questions, and requests for supporting documentation are welcome.